This is SSN.
Story Studio Network.
I'm Tom Hoppe, and I'm your host of the Most Painful Podcast. Welcome to the Most Painful Podcast. I'm your host, Tom Hoppe. On our last episode, we spoke to Kaylin Naden, and she talked about adaptability, acceptance, and self-regulation, and how that can help manage chronic pain, and also how to develop personal strategies. If you missed this episode, you can listen to it on our Spotify and Apple Podcast. In Season 3, we talked about traumatic brain injury and the impacts it can have on the body. Many of you have may heard about brain fog, but what is it, and how does it impact quality of life? Today, I'm joined by Ronessa Dass, who has just completed a research project on brain fog, and she's completing her PhD. Ronessa, welcome to the show.
Hi, Tom. Thanks for having me.
So let's start off. Just a quick background. You're at McMaster's, is that correct?
Yes, that's right.
Yeah. So you're at McMaster, and maybe just tell us quickly what you're doing, and then we'll get into the research project.
Yeah. Okay. So I am a first-year PhD and occupational therapy student in the School of Rehab Sciences. And the project that we're actually talking about was a part of my master's, which was also funded by the Chronic Pain Center of Excellence.
Great. So it was about brain fog. So maybe just kind of let's do the 30,000-foot view of the research project, and then we can start drilling down into what it's all about.
Yeah. So we were interested in looking at brain fog and kind of how that impacts the quality of life of veterans. And so I guess everything about the method. So we did focus groups, just kind of asking people, how it impacts their ability to do the things that they value. And we also had them complete some questionnaires, so health-related quality of life. And we just compare that by looking at the level of pain interference. So
maybe, is there like a definition for brain fog? I mean, there's looking online, there's kind of different terminology, but what would be the correct definition of brain fog, and how does it impact people?
Yeah, we actually work with veterans to create our definition. So it was basically looking at how brain fog impacts participation in daily activities. And that's the one we're building on right now, but we are hoping to actually solidify it a little bit more in my PhD. Right now, what we have is brain fog is a feeling of mental cloudiness that creates challenges with thinking and feeling, and that can also affect how people participate with their daily activities.
And I mean, this is not just for veterans. This could be anybody who is struggling with that. So is it more prevalent in patients with chronic pain, or could anybody suffer with brain fog? That's the first question. And the second one is, what causes it?
Both great questions. And what's interesting is that it's actually seen in a lot of different populations. So, of course, people with pain, fibromyalgia, but also it's talked about a lot recently within long COVID, but also people with menopause, people with celiac disease. So it does seem to be a phenomenon that kind of spreads across different groups. And in terms of what causes it, we don't really know. And part of that is because we don't really have a great way to measure it right now. There aren't any standardized assessments. But right now, what it's mostly attributed are things like hormonal changes, inflammation in the body, and particularly in chronic pain, sometimes it's attributed to the fact that when you have pain, there's so much going on in terms of signaling in the brain that might kind of take away from your brain's ability to focus or pay attention to other cognitive processes.
So from what I'm hearing you say is it's fairly new, brain fog,
Yes.
Or is it something that's been around for a while but just hasn't been able to be nailed down exactly what the causes?
So it's been around for a while. So the reason that we got interested in it is because we actually saw it a lot on online discourses of people with lived experiences and just kind of talking about it on social media, on blog posts, on kind of those gray literature sources. So we thought that'd be a really interesting opportunity to do patient-driven research and try to identify evidence supporting this experience, because there isn't a lot of information on what actually causes it, what are the longitudinal impacts, and how we can really support people with this experience.
So, I mean, the term brain fog, then, from what I'm hearing you say, is that something that was kind of the terminology came up from these discussions groups, or is that an actual medical term that's being used for this condition?
So it's not a medical diagnosis. So I don't think it's a medical term, but I think it's a term that just kind of the community has came up with.
So you're just trying to, I guess, clarify really what it is then and how a person lives with brain fog.
Absolutely. Just trying to figure out, what could be causing it, what exactly is the experience like, and just because if you have a definition, then it makes it a little bit easier to have these discussions about it and to bring it up within a clinical setting, but also easier so you can study it and figure out what's going on.
Right. So has there been any other, when you're looking at your research, has there been any other medical studies on this condition?
There's been a little bit within the field of fibromyalgia, and we've seen a few qualitative studies. There's also been a few within long COVID, but the issue with those studies is that there's not really a good way to define brain fog and measure it. So there's some limitations there, but there are some other studies in other populations.
So what I'm hearing you saying, because there's no way to measure it, so really it's what the patient's feeling and what they're telling you their experiences are. So is it possible that there are other medical conditions when a person thinks they have brain fog? Could it be another medical condition, or is it really separate from? Does it stand on its own? I know that might be a bit confusing.
No, that's a really great question. So a lot of it does seem to for example, there's a bit of overlap with PTSD. So a lot of people kind of describe having that dissociative feeling when they have brain fog, like feeling that their kind of mind is outside of their body. And as we know, like that's something that people with PTSD also experience. So it is quite possible that, maybe it's just PTSD and it's being lumped with brain fog, but it's also possible that maybe they are two distinct things and they just have very similar experiences. But yeah, there's definitely a lot of overlap. As we know with chronic pain, everything kind of overlaps, which makes it very difficult to figure out what's going on.
So what were some of the experiences that your, I guess, research participants came up with when they described they're having brain fog? Like what are the symptoms that they would have?
So a lot of people would describe issues with kind of this mental cloudiness feeling, and it'd be like cognitive challenges. So things like word finding, paying attention, remembering things like planning. So a bit more of those executive function as well. And they also described kind of a lot of emotion associated with it as well. So because they were unable to do the things that they used to do, and they kind of felt like they were losing a part of their identity, then we had a lot of people talk about being really embarrassed to be in social settings, being very angered because they have that lost sense of identity, and just kind of a lot of shame associated with it as well.
So when you looked at at the research participants, what linkage was it? So did someone have PTSD? Did they have chronic pain? Did they have depression? Did they have, like, when they were talking about these things, did they have those other conditions as well? Or were there people you spoke to with brain fog that did not have any other cognitive conditions?
So everybody had pain. And because we were looking at the veteran population, everyone also had some sort of mental symptom, whether that be depression, anxiety, or PTSD. A lot of the times it was kind of all of it at once.
Right. So it's hard to, once again, define exactly which one is causing what, right, in a sense.
Yeah. And I have an example actually at kind of how intertwined they are. So one participant actually told us that when he has pain, he has brain fog. And when he has brain fog, it makes it harder for him to do things around the house, like support his wife. And then because he's unable to do the things that he values, then he starts to feel depressed. And then because depression and pain are related, the more depressed he feels, the more pain, and the more pain, the more brain fog. So there's a lot of these very vicious cycles that is difficult to escape once you're feeling something like this.
Yeah, so it sounds like it's a bit of a hard one to really separate, like you say, measure. Are you seeing that the research is moving towards trying to determine what's happening within the brain when you have brain fog?
Yeah, so that's actually something that we're hoping to do. So we're actually hoping to develop an assessment of brain fog within my PhD. And I haven't seen too many studies actually kind of looking, like, are you thinking about mechanisms of it?
Yeah, I think so, yeah.
Yeah, I haven't seen too many studies do that yet. I've seen a bit more qualitative and survey studies. But I think that that's something that's really important and I would like to see in the future.
Yeah, because like what I hear you saying is how do you separate when someone's struggling with other conditions? How do you say, well, that's brain fog or that's depression or it's pain or so on and so forth. So when you looked at these participants, were there any similarities? Were there any differences when it came to brain fog? Anything that really stood out?
Yeah, I mean, in terms of the experience, it did seem very similar into kind of that lost sense of identity, not being able to, be around other people, going back to work, learn a new hobby, those types of things. One interesting finding that we saw is actually slight differences between men and women. But I will kind of preface that we only had 6 women and we had 19 men. So take this with a grain of salt, but something interesting that we saw is that women actually described a more significant strain on their identity because they were unable to do things like taking care of the children, household responsibilities, and going back to work. And men actually describe being able to offload a lot of these tasks to their women spouses. And if we just look at traditional gender roles, we know that these are roles that women tend to take on. So a lot of these organizational roles, and they often don't have anyone that they can offload these tasks to. So that was an interesting finding there that we thought should be explored.
Yeah, that's interesting because, I mean, that's actually one of the talks we're going to have later in this season is exactly that, the roles and the impact chronic pain has on female veterans. And from what I'm hearing you say, it could be non-veterans as well, because I would suggest the roles are the same in any household or most households. So what are some ways, so someone who's suffering with brain fog, how do they actually know? So they haven't been diagnosed. Did people say how they really knew that it was brain fog so that they can, or are they able to separate it from their condition that they have to say, yes, this is brain fog. It's not chronic pain. It's not PTSD. Mm-hmm. Did any of that come out in your research?
Yeah. So some people, they came to us and they had kind of figured it out on their own based off of kind of whatever discussions they've had on social media or with their peers or their doctors. So they were kind of able to come up with that based off just descriptions that they read and they felt that they aligned with. And what we had done is when we were also recruiting, we came up with this preliminary definition that we made from a scoping review that's actually published now if you're interested. And they basically, we showed it to them. And then again, if they kind of aligned with those experiences, then they kind of, I guess, self-proclaimed. I guess, I don't know if that's the best way to phrase it.
You said something that's just interesting, and I'm going to poke at it a little bit, hopefully not upsetting people. But when someone's on social media and reading about it, does that potentially set them up to self-diagnose versus, like they're reading about it, say, okay, that's what I have, versus they may not have that. You know what I'm saying? Like social media may support something that they think they have, but may not have. Does that make sense, what I'm trying to say there?
That's a really good question, because as we know, like there are so many like harmful effects of social media, and that might come up for them. But it's also a very powerful tool because that's where a lot of people can kind of realize things for the first time. So we kind of hope that they would see it and then bring it up to a medical professional or, try to have that conversation going. But that's also kind of why we're doing this study as well. So it can kind of help to validate people's experiences.
Yeah. That's really good to hear that way. So when you're doing the research and you got the participants, and you're looking at brain fog, 2 questions. How long on average did people have it before they realized what it was? 2, what were some of the coping strategies they did on their own? Mm-hmm. And then I'll have another follow-up question after that.
Yeah. So on average, I think it was a couple years for some people. But many of them, they didn't actually know what it was until kind of coming across the materials of the study or kind of coming across it through a different avenue, but they felt like they had it for maybe a year or so, I think, on average. And then in terms of coping strategies, so some people would describe things like cognitive tools, so maybe journals, calendar reminders, those types of strategies. But also those strategies weren't always the best because sometimes they could get confusing and sometimes people would forget to use them. Other people would just try to deal with kind of the emotional aspect of that and try to regain a sense of their identity. So whether that be taking up a hobby, trying to go back to school, those types of things. But also brain fog can kind of make it difficult to engage in those things. So for example, if you're having difficulty paying attention, then it's harder for you to go back to school and deal with that emotional component. Or if you're having trouble, communicating with people, then you're more likely to self-isolate, and then you're also not being able to kind of deal with those mental health effects as well.
Yeah, that is kind of double-edged sword, right? Especially when you're talking about identity, and that's a lot what we've talked about with military veterans, same with athletes, and I would suggest anybody, even if someone has a car accident and they lose their job, which was their identity. So it seems, I keep hearing from you with brain fog is identity is important. Mm-hmm. So if we have a veteran who's struggling with identity adjustment, which can lead to depression, lead to a sense of loss of worth. What were some of the feedbacks you had from people? Like, did they understand that the transition out of the service could have contributed to brain fog, or vice versa, brain fog could have made it worse?
Yeah, that's actually interesting that you asked that because not a lot of people touched on that transition piece. They mostly kind of attributed it to their pain or whatever other health challenges that they were going through. But that is something that we actually want to dive into in the next stages of the study, just kind of looking at the social context that might be about that. Because I guess you're right, like that transition process can also affect your identity.
Yeah, and we know with the military mindset and identity, which we've talked about on this show a few times, is if veterans are doing very well in a pain program and they're coping well, but they get home and they have no purpose and they're struggling with identity, then it impacts their depression, impacts their pain.
Yep.
And then if they're having brain fog, I would suggest that probably impacts that as well.
Absolutely.
Yeah. So that's something I guess you guys are going to look at. So in this study, did you look at any treatments, coping skills, anything like that could help somebody?
So we, because it was a very, very early stages of the project, so we did ask people what kind of they use to see if that is something that we could test later on. And that's, again, what we're hoping to do in the next stages. But I guess there weren't a lot of treatments. It was mostly just thinking of how you can manage it. So whether that be maybe managing your pain for that day or managing your other symptoms, so like your PTSD and anxiety, sometimes that could also help it. Sometimes it was just about taking a step back and practicing things like mindfulness and reflexivity. And then other times it was just, maybe using a tool, like maybe using a journal. Actually, a lot of the same strategies that you would probably use for chronic pain. But I will say it was kind of a lot of trial and error of figuring out what works best for you. And what I noticed is that if it was someone who's dealing with pain for a while, they would have more strategies. But if it was somebody who was kind of talking about experiencing it for the first time, then they wouldn't have been able to figure out what works best for them quite as yet.
So that kind of just touches on something we've talked about in the past too. So someone who's maybe gone through an interdisciplinary pain clinic like the DeGroote or in Hamilton or Change Pain in Vancouver, you're saying they would probably have better kind of coping strategies for brain fog than somebody who would not have been able to go through a course or a program like that.
Yeah, I think those interdisciplinary programs work well because you do get to kind of build a rapport and really kind of work on that whole multifaceted aspect of pain. But somebody who may not have access to those same resources might have a bit of a trickier time because they're not really able to talk about those things. And often a lot of the times with people who have chronic pain and who don't have access to those interdisciplinary clinics, when they see their healthcare professional, they're probably talking more about their pain, their PTSD, and whatever is most pressing, because you kind of have like 10 minutes with a family doctor. Right. So sometimes brain fog might kind of fall at the bottom of your list. You're not always bringing up those cognitive challenges. And also sometimes you might think that it's, you're just stupid or something. So that's what a lot of people said. They said that they thought that they were just dumb or that they weren't trying hard enough. So they were too ashamed to bring it up and have that discussion.
And which raises another point is because I know many veterans and probably many people I've talked to, family members now too, who don't even know what an IDC is, interdisciplinary clinic, and don't understand the benefits of the biopsychosocial model and that whole approach. So then people, you don't know what you don't know. So now they're struggling with that and they don't have the coping skills. So that's an interesting kind of thought that you bring up, is someone struggling with brain fog who's been through an IDC probably does better than somebody who hasn't because of that holistic approach that's in there.
Yeah.
Does that kind of make sense?
Yeah, I mean, that's not something that I've tested myself or seen, but that's what I think would happen. I think that makes good sense.
Well, I can say from my own experience, and I guess other people I've interviewed or spoken to who've been through IDC compared to somebody who has not, I would suggest coming out of an IDC, a person tends to have more knowledge than somebody who doesn't, because they're aware of it more, right? So, so anything else? Were there any other in the mainstream other research on treatments or coping strategies that people could use, or is it just been kind of trial and error on people's own part?
Yeah, I've done a bit of work looking into what other populations are suggesting, and again, it is kind of just that trial and error. I can't find, or I wasn't able to find anything that seemed to work very well for everyone. Because even something like medication, like for some people, medication makes it worse. And then for other people, medication, it relieves their pain, which relieves their brain fog. So yeah, very, very tricky.
It is, eh? And at the conference where we met, I know you had, if I remember, it was a bit of a quick reference guide to brain fog. Is that correct? Did you guys develop?
Yes. I have some social media tools and a reference for healthcare professionals that I can share with you as well.
Yeah. So would you be able to give us is it a short link you'd be able to just tell us online here, or is it something people have to write down?
I don't have a link to it. I was just going to post it as kind of a social media campaign. So I can send it to you and you can post on your social media if that works, or I can post it on mine and you can repost it.
We could do that. That's perfect. Yeah. Because I looked at that and I thought that was very helpful. So I think that's something that will help people. Any last takeaways for people that you think would be helpful?
Yeah. I mean, I feel like, I don't have a lot of answers in terms of what causes it and what's probably the best way to treat it. But what I do think is that by spreading awareness and kind of having these discussions is really important, because there is kind of a shame associated with it and not a lot of people will go and ask for help. So if you have that kind of awareness of, it's not just in your head, it's not just something that you made up, and that it is something that you can get support with, I think that that'll really help to push the discussion and help more research and more people get support.
Awesome. Well, it's early days, and I thank you for putting the effort into it. And I look forward to when you finish the next one. So thank you for being on the show.
No, thank you so much.
And for the audience, we'll keep an eye on that social media post from Ronessa, and then we'll either have it on our Spotify link, an Apple link, and you can click on it. And that might help you if you're struggling with brain fog. So our next show, we're going to have Dr. Ferland back on, and she's going to talk about what happens if your family doctor doesn't understand your chronic pain. And what can you do about that? I think that's an important discussion, because many, we actually just talked about it here, where people don't think they have the knowledge or the insight on how to talk to their family doctor about chronic pain. So that'll be on the next show. For feedback about the show or more information on chronic pain, you can visit our website, veteranschronicpain.ca, or you can follow us on Facebook and Twitter at Chronic Pain COE, and on Instagram at Chronic Pain_COE. Ronessa, thanks again for being on the show. And to the audience, stay safe and keep the hope alive.
The Most Painful Podcast is produced for the Chronic Pain Center of Excellence by Story Studio Network.